Howdy guys, today's topic, rheumatic fever. So once again, because this is your exam tickets, let's talk about rheumatic fever. Take your pens, papers, and let's go, folks. So what is rheumatic fever? How to answer exam question. So you start with definition. Always you start with definition. Doesn't matter what exam question you've got. So what is rheumatic fever? Rheumatic fever is a nonsuppurative, acute inflammatory complication of a group A streptococcal infection, pharyngeal, of course, infection, causing combinations of arthritis, carditis, subcutaneous nodules, erythema marginatum, and chorea. Diagnosis is based on applying the modified Jones criteria to information gleaned from history, examination, and laboratory testing. It's okay for any pathological condition. Treatment includes non-steroidal anti-inflammatory drugs and aspirin and or other non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids during severe carditis, and antimicrobials to eradicate residual streptococcal infection and prevent reinfections. So this is a definition. Then, pathophysiology. The disease occurs when the body's immune system reacts to the streptococcal bacteria, mistakenly attacking its own tissues, particularly the heart, joints, skin, and central nervous system. Etiology. We talked about gas, so caused by group A streptococcus infection, so-called gas infection, group A streptococcal infection, often follows untreated or partially treated streptococcal pharyngitis. Pathogenesis. Immune response to gas leads to cross-reactivity with immune tissues, so-called molecular mimicry, affects multiple systems, cardiac, most serious. That's why actually rheumatologist comes from cardiology. Cardiological problems, joints, skin, and central nervous system. So where we've got connective tissues. Clinical features. So we have a joints criteria, big and small, or major and minor. It's absolutely necessary to remember that. Major criteria, if you are asked, of course. Migratory arthritis, carditis and valvulitis, pancreatitis. Sydenham chorea, erythema marginatum, subcutaneous nodules. These 5 are principal. Migratory arthritis, carditis and valvulitis, pancreatitis. Sydenham criteria. Chorea. Erythema marginatum and subcutaneous nodules. Minor criteria: fever, no more major criteria. Fever, arthralgia, elevated acute phase reactants, ESR, CRP, prolonged PR interval on ECG. Phase reactants, ESR, so sedimentation rate, and CRP is a reactive protein. About management, C-reactive protein, CRP. Management, so acute phase, antibiotics to eradicate streptococcal infection. Penicillin is the drug of choice, no questions. Anti-inflammatory treatment, aspirin or corticosteroids. Supportive care for carditis, heart failure management if needed. Complications: chronic rheumatic heart disease, which can lead to severe valvular damage, heart failure, atrial fibrillation with strokes, and increased risk of infective endocarditis. So, that's great. So if you find a question about rheumatic fever, my beloved, start with, just from my part, everything from my part. Anyway, start from definition, then be quite specific. Read the question carefully for that. Identify what specifically is being asked. Identify pathophysiology, clinical features, treatments, complications. But start with definition. This is quite important. Quite important. So provide a definition and etiology, rheumatic fever, pathophysiology, explain how the immune response to gas leads to tissue inflammation, list and describe the major and minor criteria. Okay? So diagnosis, explain how rheumatic fever is diagnosed using clinical criteria and evidence of preceding infection. Management, detail the treatment approach for both acute rheumatic fever and secondary prevention. And summarize key points and mention the importance of early diagnosis and treatment to prevent complications. So absolutely quite enough, quite enough for your answer and for, I think, for excellency. So God bless you. See you in another lectures, my beloveds. That's all about rheumatic fever. No, for exam, of course. So very briefly. God bless you. Bye.